go.
Hey, I'm Beth.
And I'm Reese.
So today we're going to be getting him up from a wheelchair and walking with a walker. So this case is a 67-year-old with a left hip fracture and also a history of osteoarthritis. Because we don't know his balance and because of his age, we would probably choose to use a walker as the ambulation aid. So for the walker, the way that you would fit it when they first stand up is to make sure that it's about even with their greater trochanter, or if their arm is hanging straight, right about where their wrist crease is. So when they're standing, their arm should be at about 20 to 30 degrees of flexion. And the way you would adjust that height is you would slide these up and down by pushing this little button in and adjusting it. So once you have this up, you can transport it by pushing these buttons down and folding it in. And then when you bring it back out, just make sure it locks to use. So we would start out, and the first thing we would check with our patient is that they're wearing their gait belt and the wheelchair locks are on. And you would demonstrate everything for your patient before you do it. So for this patient, we're going to use a modified 3-point gait pattern, which will be the walker will go first, and then their affected leg, which is his left, they'll go out forwards, and he's going to be toe-touch weight bearing, so he's not going to put any weight down on that leg. So he'll put most of it on his arms and then bring that right foot to meet it. And so you just go walker, unaffected, affected. And then you'll go ahead and demonstrate how to get up and down for the patient also, but for the sake of time, I'm just going to go ahead and direct him. So you're going to swing the wheelchair legs out of the way. Again, make sure that the locks are on and that the patient is wearing a gait belt. If you haven't had the patient up before, you might also use an aid just to make sure that if they fall, you can catch them. So what you're going to do is bring the walker right up next to the patient, and you're going to have them go ahead and scoot out to the edge of your wheelchair. And when you stand up, I'm going to have you lean forward and make sure that you push off of your wheelchair armrests and not use your walker to stand up, just for safety. So do you understand and feel comfortable with the gait?
I do.
Okay, so I'm going to go ahead. You're going to guard by having one hand on the gait belt behind them and the other one in front of them. So you're going to go ahead and lean forward and stand up. And then once you've got your balance, grab your walker. And the gait pattern again will go walker, and then left, and then right, making sure not to put any weight on that left leg. So walker, left, right. And then when you make turns with the patient, you want to ask them to make really wide turns, so we can go ahead and turn to the right. And you want to make sure that they're not pivoting on that right leg, just so that they don't get injured. Make sure there's no obstructions. And we'll head back to the wheelchair. And again, when you go back to the wheelchair, make big turns again. And you're going to have the patient back up to their wheelchair until they can feel the wheelchair behind them, up against their knees. At that point, they can reach back for the armrests and slowly lower themselves down safely. And that is everything you need to know on walking